Hi everyone, I'm super excited to bring you the very first tales of our medical system with Pharmarbiter. It's still your humble, accessible, digital lady pharmacist, Juliet Chinelo. Before I proceed to read out our tales for the week, I would like to remind us all that the essence of this forum is not to ridicule or pick on any healthcare profession. All we are trying to do is to get reactions from the service users, those the patients who we are looking after, if they have concerns, if they're happy with the services we are rendering, if there are one or two knots we could tie at any end to improve on the quality of the service we render and have them somehow more satisfied and happy. So that's the essence of this. Don't feel offended, okay? So I'll just grab my gadget and weave through our two selected tasks for the week. And one more thing. And if you check through our inbox, you will notice that 70 to 80% of the ordeals reported are against doctors. And that is, I expected that, because they are always at the helm of affair in the medical system and consulting and making all the decisions. So patients come more in contact with them. So it's quite normal, not because of the awful people or something like that, but because of the contact ratio. And the next profession is nursing after doctors. Okay, I'll read now our very first tale of the week. Hi Pharmarbiter, a doctor said to me in the consulting room, "Madam, shut up and listen. I have too many patients waiting for me outside there. All you need to do is to pick up your medication from the pharmacy, take them as prescribed, and come back fortnight for a review." I know I was not spoken to fairly, but since I started seeing him, my blood pressure and diabetic condition improved. He is just often impatient and arrogant, and I don't like the way he speaks to me at times. I understand, trust me, I do. And our second tale for the week, I'll read, and I have to alert you, it's a very long story. Hi Pharmarbiter, please withhold my information. Of course we will. You're just reminding us, we know about the Privacy Act. We keep your information private unless you've opted that we should make it publicly known, and we only give out the level of information you allow us to. I read now. I have a growth on my pussy area as opposite that to vagina area, which was diagnosed to be genital wart. This is what genital wart looks like. And polyphylon gel was used to remove the wart successfully. To cut the story short, I got worried on why I should have genital wart in the first place, because I'm a well-traveled, exposed and informed lady. So I got talking with my gynecology doctor friend, who advised me to go for cervical cancer screening. I was not comfortable doing it within my area because I don't want to bump into someone I know and have them open me up inside speculum to check me. So he got it arranged for me to come to another state where he is doing his residency program. I also prefer to have a female doctor do it for me, but unfortunately he could only get 2 of his female colleagues to carry out the procedure on me, and the female doctor he contacted joined in the middle of the process. My experience was awful. Immediately the female doctor walked in, she grabbed a torch from one of them to look through me. The next thing she asked was gravida 1, 2, 3, and I was wondering what on earth gravida meant in medical term. She now walked up to my head area, leaving the tissue they were supposed to be collecting for cervical cancer screening. The first question she asked was, "Are you married?" I answered no. "How many kids do you have?" "None," I answered. "Have you had any abortion?" Was the third question she asked me. Refer to the medical history which was previously taken, was what I replied in a rude way. No. She cannot say she has not been pregnant with what I'm saying, was what she said, looking furious and grabbing my history note. I calmed down and allowed them finish with the procedure, and I had some tissues taken out for my cervical cancer screening. I confronted the one among them that was my friend to talk about my disappointment. All he could say is that the procedure normally are carried out by nurses or house officers, that he was only trying to help, thereby arranging to have him and his colleagues carry out the procedure for me. You know how you ladies are. Mind you, she's the only consultant among, and the rest of us are resident doctors. That is our second tale for today. A lady narrating her ordeal on how she was treated. Let me know what you think. We want all the comments coming through, whether the female doctor was right to be talking to her in that way, or whether the right thing she should have done is to do the medical procedure and discuss it later with the rest of the team. Let what you think come true, and don't forget, by this time next week we will have answers to these 2 ordeals reviewed and discussed with you guys. Thank you for joining us today. We love all, be overwhelmed by your love and your support and everything. If you would like to see more of those, time up. Thank you once more. Julia Chinella from Pharmarbiter. See you guys next week. Bye for now.